Welcome back to the podcast Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth about the medical system. Today's topic is knee pain, probably more around the whole topic of knee osteoarthritis, maybe patellofemoral syndrome, you wondering whether or not you have a meniscal tear, a muscle tear, a tendon tear, something like that. And I want to let you know this is not as scary as you think, and we're going to break down the basics of the anatomy today. Don't let me lose you there. And talking about how you can actually build the strength around the knee and ultimately get this fixed. See, when we talk about knee pain, most people immediately think of the big scary stuff. Like I said, ligament tears, meniscal injuries, even arthritis, which I know you probably have bad knees, right? Your dad had bad knees, your mom had bad knees, all these people have bad knees. And so, you know what? You're probably going to have bad knees too. That is not true. That is not true. Here's the thing. If your pain came on slowly without a specific injury and you can still walk, bend, and move your knee, it's probably not torn. It's probably not a torn ligament, probably not a torn meniscus. And even if it is, those little menisci, man, not only do they heal, but they can even work fine with a small tear in it. And while osteoarthritis sounds intimidating, it's not a death sentence for you. It's not a death sentence for your knee. It'll be okay. The research is actually very clear. Rest does not help arthritis. Movement does. There are times where I will want you to rest for a day, a couple days, maybe a week. But more times than not, low-grade movement without too much load is far better than any sort of rest. So if your knee pain has been creeping up over months or years, if it's come and gone, then this episode is going to help you understand what's actually going on and what to do about it. Now, I will say, when people say, what should I do about my knee pain? I will always lead with, you should get properly evaluated by a good physical therapist. Two things. Properly evaluated, dig deep into the little pieces of your knee, of your background, of your lifestyle, all that stuff, by a good physical therapist is the second one. There are a lot of times where you will get onced over by a physical therapist who just does a bunch of tests and starts you on the most basic things and never really takes you anywhere. If you're not loading that knee over time with heavier and stronger movements, then you will not actually solve this for long term. If you've been dealing with knee pain that comes and goes, you've stretched it, you've iced it, you've even rested it, maybe even backed off of workouts, and it still comes back, all of what we're about to go through is for you. It's normal to be frustrated with this. Even when you do everything right, sometimes things go a little bit wrong. You've tried all the right things, and yet you're still dealing with this pain. Also, what if the problem isn't even the knee itself? If you've listened to my other podcasts, you probably know that I'm going to start pointing upwards towards your hips. It's probably going to be a little bit higher up the chain. Okay. By the end of this, you're going to know what's really going on. I want you to think in general about the knee as a joint with muscles that can only handle what it has been told to handle. If you have a knee that is relatively weak compared to the stresses that you place upon it, it's going to yelp out in a little bit of pain. If you do that over and over again, over a long period of time, it's going to get more and more painful. Pain does not equal damage. You can be in pain without things being damaged. You can also have some damage without being in any pain. So just because it hurts doesn't mean it's broken, torn, or even really damaged. It could be signals being sent to your brain saying, we are not strong enough for this. We need to do something about it. Of course, when you take time off, let me go through this thing, right? You take time off, the pain goes away. You're like, look, I fixed it. It's like, no, you removed the insulting movement. You've removed the thing that hurts you. And right when you go back to it, the pain's going to come back. Okay. So ultimately, if your knee or the muscles around it don't have the capacity to handle what you're doing, it's going to start yelping out in pain. So by the end of this, I will tell you a little bit more about how to ultimately strengthen those tissues, increase their capacity so that you can handle what you want to do in everyday life. The question is not what's wrong with my knee. It's why can't my knee handle what I'm asking it to do? Now, if you've ever typed in how to fix knee pain on YouTube, you've probably seen 100 different answers. Quad stretches, glute work, foam rolling, new shoes, all the different things. But I'll tell you what, in that really good evaluation by the physical therapist, you should be walking away with answers pretty concise down to 2 or 3 things that you have problems with, whether it be weakness or mobility deficit. and immediate antidotes for those. If you're weak here, what exercise should you do to strengthen it? If you're not very mobile here, what should I do to mobilize it, whether it be stretch or mobilize? Mobilize could be repeated movements. It could also be soft tissue work. And so there's multiple different things that it could be, but the majority of the time, you have a quad that is not strong as it should be, or not as strong as it should be in the range of motion that you want to do with it, or it's coming from up the chain. You have weakness in your hips, and the knee is paying the price. Let's say you have knee pain on the inside of your knee. So on the medial side is what we would say. The majority of the time, the knee being a hinge joint, the knee is having inside of the knee pain because the muscles that attach along the inside of the knee are having to work overtime for what the muscles on the outside of the hip are not doing. I want you to picture someone standing on one standing on one leg. And as they stand on that one leg, their knee caves in. Now, their knee is most likely caving in, not because the knee is the problem. The knee is doing the best it can. The knee is caving in because the lateral hip or the outside of the hip is not strong enough to keep that femur or thigh bone pulled outward and in alignment. If you strengthen the lateral hip, you will see the medial knee improve its symptoms. It'll be in less pain. So again, if you've typed in, how do I fix knee pain? You are going to get 100 different answers, and almost all of them will not align with you. But if you've tried some of those things and you start to get traction, you start to see improvement, first of all, fantastic, good for you. 2, bring that to your physical therapist and tell him or her what you're doing and what you think it is based off of what you've tried and has worked and what you've tried and has not worked. See, the majority of the time, it's a diagnosis problem. You are chasing 100 different things, and so is the physical therapist, because they don't know how to appropriately locate the tissues that are actually causing the problem, and that's why you're not getting better. You're not getting better because you're not addressing the right thing. You're not getting better because you're just resting and not strengthening, whatever it may be. A physical therapist, an appropriately trained physical therapist, is supposed to evaluate and assess, not guess. Let me tell you this. It is really interesting when someone comes in with pain on the inside of their knee, medial side of their knee, and I poke around on all those tissues, and they're a little tender, but nothing major. We test quad strength. That's totally fine. We test hamstring strength. That's totally fine. We test adductor strength, the muscles that squeeze your knees together. That's fine. We test structures of the knee. No meniscal tear, no ligament tear. Kneecap moves around just fine. And patient's starting to look stumped at this point. So we cruise on up to the hips. We test hip external rotation. We test hip abduction. We test hip internal rotation. So how stable is the hip in rotation, and how stable is the hip on medial lateral knee movement? And that's where we find it. They have significant weakness on the outside of their hip. We start strengthening those tissues, do a little bit of dry needling. We have them do a repeat test. Maybe it's a step down. Maybe it's walking upstairs. Maybe it's doing a squat. Maybe it's a single leg squat. And they notice their pain goes down. Their pain goes almost away until we start adding weight. Then we start noticing, maybe the knee's paying the price, like I said, for weakness of the hips. See, this is a true story. This is what I see very often in people's knee pain. This is what is most common. And the downside, let me go on a little bit of a rant here. The downside is if you are over 40 or 50 years old and you've used your knees in any capacity, and you go to a regular primary care physician and or an orthopedic surgeon, they're going to take an x-ray of your knees. They're going to put it up on the wall, and they're going to say, look, it's bone on bone. Let's get you scheduled for a total knee replacement. And you're like, holy crap, man, I'm really that bad? Maybe grandpa really did pass down some genes to me, some bad knees. He had to get a total knee. So did Uncle George. So did my mom. I guess I'm just due. And then you get scheduled for the total knee, and here we go. And it's like, did he even test your single leg strength, your single leg stability, the ability of your knee to bend, how well your quad can contract? Did he test your hip strength? He or she? That's what is frustrating, is you'll get signed up for this total knee or this orthopedic surgery without any actual structural and strength testing going on. See, they do that because on the x-ray, the knee may look fairly poor, but I've seen some pretty poor x-rays and MRIs with no knee pain, with no lack of knee strength, with no actual issues, but it's a bad picture. See, I challenge you on this. I challenge you to ask the difficult questions. Do you think it would be okay if I started physical therapy? Do you think it would be a bad idea if I went and tried to strengthen this for 3 months? Do you think it would be a bad idea if I went and walked more, lifted a little bit of weight, just did squats every day? Ask those questions if you're in front of an orthopedic surgeon and see what they say.
Hey, it's Clayton. Quick mid-show favor. If this episode's got you nodding along or saying, that's interesting, do me a solid. Leave me a review or send it to that one friend who needs to hear it. You'll make my day and maybe save them from another bad doctor's visit. Thank you. Let's get back to the episode.
See, because when you come into my office, I don't necessarily care right out the gate what the knee looks like underneath the surface. My question is, do you strength train it? What does your quad contraction look like? What does the knee flexibility look like? Is it tender here? What is the stability like of the hips? What does it look like when you walk? What does it look like when you sit down, when you stand up, when you go upstairs, downstairs, balance on one foot? What do those things look like? Because those are controllable things. Those are things that we can change. Those are things, you can change as the patient, as the client, as the person who is the most important piece of this puzzle. That is what frustrates me, is when it comes to the medical system, the most classical experience, it hurts, take a pain pill. It's still hurting, let me inject it. It's still hurting, let me do surgery. No, what it should be is, my knee is hurting. Let's think about, hold on, what is making it hurt? What are you doing when it hurts? What are you doing that leads it to hurt? What do you do that makes it stop hurting? Let's go change those things. Let's do more of this, less of that. Less of this, more of that. Let's go ahead and test hip strength, back stability, knee strength, ankle flexibility, movement patterns. What are you doing on the day-to-day basis? Have you tried strength training? Oh no, you just do elliptical for 2 hours every single day. Maybe that has something to do with it. Oh no, you sit at work for 12 hours a day. Maybe that has something to do with it. I'm not here to make fun of you or judge or anything like that. It's, let's look at your 24-hour schedule and let's see what pieces we can change first, completely conservatively, with no pharmaceutical medications, with no injections, with no cutting, no surgery. Let's go change those things. This is something that is near and dear to my heart, because so many people will get unnecessary surgeries and injections for knee pain that has never been appropriately assessed, evaluated, and ultimately strengthened. Here's one test that you can do right away that will tell me and tell you if you have good quad strength. Quad is that muscle on the front of your thigh that pulls the knee upwards. It is one of the most important ones when it comes to walking. If you are sitting down, not driving, if you are sitting down, I want you to sit on like a flat surface like the floor or a couch where your foot is propped up. You should be able to tighten up your quad, which will make it look like your knee cap is sliding up towards your belly. Or you can think of it as pushing the knee down towards the ground. You should be able to lock that knee into full extension, making your heel pop off the couch or the floor. Essentially, you're making your knee go into hyper extension. If you are unable to do that, there's a decent chance that you have lack of full control into full extension of the knee or of the quad. That is one of the most important movements and strength pieces when it comes to walking. And if your pain comes on after a long bit of walking, it's probably related to your lack of ability to fire the quad to its fullest extent. That's just one small test. Some people pass out with flying colors, and sometimes people on day one, even though they can squat 300 pounds, they fail that. We go clean that up. Their knee pain starts to go down. It can be this simple. You need to get yourself in front of a physical therapist who can appropriately assess and evaluate not only your knees, but your hips, your ankles, your low back, your day-to-day movements, your 4 pillars: hydration, nutrition, stress management, sleep quality, all of those things. See, you wouldn't guess what's wrong with your car. So you shouldn't guess what's wrong with your knee. You should get evaluated. You should get assessed. You should get answers and get back to living the way you want. I will throw a starter program down in the link in the bio or in the podcast description below. I'll put that down there for you. You can go check it out. See what you think. See if any of this helps you. But ultimately, I want to let you know, most likely you don't have any ligament tears. Most likely you don't have any big meniscal tears or anything like that. And let's say you do. Let's say you have a small meniscal tear. There's a lot of people walking around right now that have meniscal tears. I'm pretty sure I have one in my own right knee, and I can still do all the squats, deadlifts, and running, everything I want. And even if you do have knee osteoarthritis, movement is the answer, not rest. And if you want help with that, please contact me. Information is down in the podcast description below. Go click on the link, check out the program. If you want to reach out to me, there's another button down below. You can send me an email and we'll go from there. I appreciate your time. I appreciate your support. If you have not yet, there are so many of you that I know listen, and I sincerely appreciate it. And I ask you one massive favor to take one extra step. Scroll down, hit 5 stars, leave me a short review. If you don't want to do that, screenshot what you're looking at right now, assuming it's the picture of this podcast. Please tag me on Instagram. I will share it on my story as well. I really appreciate you helping me get the word out there on knee pain. And please, if you have a friend, family member, mom, dad, brother, cousin, aunt, uncle, whoever with knee pain, fire this off to them. They probably need to hear it. They probably don't need to go to their medical doctor. They probably don't need to go get a knee surgery. They probably just need to get in front of a good physical therapist. I appreciate you all. I hope you have a good day. We'll see ya.